MRI is a non-invasive medical imaging technique that provides detailed images of essentially every internal structure in the human anatomy, including organs, bones, muscle, and blood arteries. MRI scanners utilize a powerful magnet as well as radio waves to obtain images of the body. In the 1930s, Isidor Isaac Rabi, a physicist, invented nuclear magnetic resonance imaging. That research established the foundation for medical MRIs. Then, physicists Felix Bloch and Edward Purcell investigated the atomic and molecular magnetic resonance characteristic of solids and liquids in the 1940s. In 1969, Dr. Raymond Damadian proposed that magnetic resonance may distinguish cancer cells from non-cancerous cells. Dr. Damadian discovered that different types of tissue emission had different response lengths, with malignant tissue having longer response signals. Dr. Damadian was the first to propose using NMR in medical imaging MRI. Dr. Damadian received the first patent for MRI technology in 1972. Dr. Damadian conceived and built a fully body MRI system after his patent was approved in 1974. The first MR magnetic resonance scanning machine, called Indomitable, was created by him. Dr. Damadian obtained the first human NMR picture on July 3, 1977. The significance of MRI is that it creates comprehensive images of the body's internal structures that are more defined, more detailed, and in some cases, more likely to discover and accurately categorize diseases than other imaging modalities. MRI has higher soft tissue contrast than CT and can distinguish between fat, water, muscle, and other soft tissues, making it more useful in identifying a wide range of disorders and conditions.
How does MRI works? The MRI machine, which generates a strong magnetic field around the patients and emits radio wave pulses from a scanner. The MRI scanner's powerful magnetic field induces the atoms in the body to align in a particular direction. The MRI equipment then sends radio waves that shift the atoms out of their original position. When the radio waves are shut off, the atoms revert to their original position and continue to send radio signals. A computer receives the signals and converts them into an image of the body section being inspected. Some important magnetic concepts in MRI. First, we have magnetic field strength. Tesla T units are used to express the strength of the magnetic field utilized in MRIs. Longer imaging times and higher magnetic field strengths are typically associated with improved image quality. Clinical MRI scanners typically have field strengths between 1.5 and 3 Tesla, while research scanners have much greater strength. Second, we have nuclear magnetic resonance, NMR. NMR forms the basis of MRI. Some atomic nuclei, like protons in hydrogen, align themselves with the magnetic field when there is a strong magnetic field present. The nuclei absorb and re-emit energy when radio frequency pulses are applied, and this can be monitored by creating pictures. Another magnet concept in MRI is resonant frequency. In the presence of a magnetic field, each type of nucleus resonates at a particular frequency. The main magnetic field intensity influences the resonance frequency. The resonance frequency of hydrogen nuclei is approximately 42.5 MHz at 1 Tesla. But we also have a gradient coils. Additional coils inside the MRI machine called gradient coils cause gradients in the primary magnetic field. The spatial according of the signal made possible by these gradients permits the production of intricate 3D pictures. It is possible to selectively scan different body slices by adjusting by strength of the gradient. Next, radio frequency RF coils. Radio frequency coils are used to both send and receive signals from excited nuclei at high frequencies. Depending on the part of the body being scanned, several coil types such as surface coils or body coil are employed. Lastly, we have T1 and T2 relaxation. The characteristic of tissues known as T1 spin lattice relaxation and T2 spin relaxation affect the signal picked up by MRI. Following the administration of an RF pulse, T1 in the amount of time needed for the nuclear magnetization to recover, and T2 is the amount of the needed for the transverse magnetization to decline. The T1 and T2 realization duration of various tissue vary, which affects picture contrast.
Now we will talk about the examples of real-world implementations. The first example is the medical diagnostics. MRI is frequently used in neuroimaging to visualize the brain and detect abnormalities such as tumors, hemorrhage, and structural anomalies. The second example is the research and drug development. Medical research utilizes MRI for studying anatomy, physiology, and disease processes. It plays a crucial role in drug development by providing non-invasive insights into the effects of drugs on tissues and organs. There are few potential benefits and challenges of MRI. One of the benefits is that MRI does not have any radiation exposure. Unlike X-rays and CT scans, MRI does not use ionizing radiation. This reduces the risk of radiation-related side effects, making it a safer option for repeated imaging, especially in pediatric and pregnant patients. Another benefit is about the soft tissue differentiation. MRI provides excellent soft tissue contrast that allows for detailed visualization of organs, muscles, ligaments, and other soft tissues. This is particularly valuable in detecting abnormalities and diseases in these structures. Challenges of MRI. One of them is about the patient limitations. Some patients may not be suitable for MRI due to factors like claustrophobia, inability to remain still, or the presence of certain metal implants that may interfere with the magnetic field. Other challenges may include the cost. Maintaining the MRI machines are expensive, making the initial setup and ongoing operational costs high. This can limit accessibility, particularly in resource-constrained healthcare settings. We will talk about the future development and innovations of the MRI machines. One of the innovations that can be made is to use higher magnetic field strengths. This is because by increasing the strength of magnetic fields in MRI machines, it can enhance the image resolution and quality and allows for more detailed and accurate diagnostic information. Another improvement that can be made is to integrate the artificial intelligence into the machine. The integration of artificial intelligence and machine learning algorithms to assist in image analysis, interpretation, and diagnosis can potentially enhance the efficiency and accuracy of medical assessments.
However, there are also few risks of using MRI. The first one is the magnetic resonance environment involves a strong static magnetic field which changes with time and radio frequency energy. For example, the radio frequency energy used during the MRI scan could lead to the heating of the body. This potential for heating is greater to happen during the long MRI examinations. The second risk is the use of gadolinium-based contrast agent, or we call as GBCAs, also carries some risks such as allergic reactions to the patient. Gadolinium-based contrast agents are intravenous drugs which are used during diagnostic imaging procedures that helps to enhance the quality of the magnetic resonance imaging or the magnetic resonance angiography. As a conclusion, magnetic resonance imaging (MRI) is a non-invasive medical imaging technique that totally helpful in medical industry. This innovative also has few magnetic concepts related to it. With this technology, accurate characteristics of the disease can be discovered and can be cured with the right treatment despite the fact that it has few risks. Safety steps should be taken to avoid any inconvenience incident. This also proves that magnetic concepts are the major important aspect in the magnetic resonance imaging, which is MRI.